Now, Health Minister Dr. Aaron Motsoaledi, alongside provincial health MECs, provided an update on key healthcare issues in the public sector. The minister announced the creation of 1,650 new healthcare positions, which included doctors, of course, and over 1.3 billion rand allocated for hospital equipment purchases. The briefing comes amid ongoing challenges in public healthcare, including inadequate equipment, unemployed doctors, and legal hurdles surrounding, of course, the implementation of NHI. Let's get some perspective now, whether this is perhaps the step in the right direction and things are moving forward, how feasible the objectives are that have been set forward as well. But the CEO at the South African Medical Association, that's Dr. Mzulungile Nodigida. Dr. Nodigida, thank you so much for the time. Appreciate it this morning. Let's just talk about what you made then of the pronouncements that were made this past week then by the health minister, indeed even aiding and bringing forward quite a few jobs when it comes to doctors. Were you happy with the pronouncements made?
Thank you very much for having us. Good morning to you and to your team and your viewers. Yes, the South African Medical Association sees this announcement by the minister as a good step in the right direction, especially as it relates to what we all know is much needed healthcare personnel within the health system. We all know that as we speak, South Africa is sitting at less than half a doctor per 1,000, which is 0.31 per 1,000. That is the doctor ratio per population. So that means there's one doctor for every 3,100 people. So it's a good addition. But what remains a concern is that, one, we know, because we've ran a survey on this, we know that there are 1,800 doctors who are outside of the system and ready to come into the system. And that is a problem, that we cannot absorb all of those. So that's the first issue. The second one is that when you listen to the minister, there's some specifics that are missing, which we would have loved to hear in relation to the posts that have been made available. One is the timelines. We know that these doctors have been unemployed since the 1st of January this year. That's the one thing. And we now don't know when are they going to be absorbed into the system. Also, there is no specification of saying these are the medical officers grade 1. Because when you say you have 1,200 jobs for doctors are in different categories. So we would have appreciated that what level of skill is being brought in. Because there's this misunderstanding that you could replace specialists with junior doctors, which is not possible. So we would have loved those details to come through. But I think the question around equipment, the 1.3 billion to be used in equipment for hospitals, we think it is a very good and a much needed intervention from the part of the minister. So we really are seeing that as something good. Then I believe okay.
Yeah, sorry, let me perhaps come in maybe there then, just to say, how do we absorb the doctors then, if we aren't able to do so through government itself? If 1,600 or 1,650 isn't supposedly sufficient at this point then, you have 1,800, as you said then, but then it's going to be a problem every year. And clearly, government may not be able to take on these new doctors every year. So what do we do?
This is why, so health for South Africans in the South African Medical Association is non-negotiable.
Yes.
It's non-negotiable. So the health of the nation is critical. So we need to plan. I think the fundamental problem, the way we see it as some, is that there is some lapses in terms of planning. We knew that these doctors were coming through. We know now how many junior doctors are coming out of community service. We know now how many are coming into internship. on the 1st of January. And we knew when they started the first year of medical training. So I think this is something that, of course, notwithstanding that there are certain glitches in terms of changes in environment as we plan, but for us at SAMA, we take the health of the nation very serious, and we think that as the minister plans, both the Ministry in Treasury and the Minister of Health, we cannot continue to have announcements made on doctors. We need to have almost a ring-fenced kind of funding, which could be called a conditional grant that absorb these doctors. If we were talking about a sector that does not have the need for doctors, if we were saying we had 2 doctors per 1,000, we would not be. We would be saying that the market is saturated. At the moment, South Africans struggle. And the sad thing is that what South Africans go through doesn't really come through when we talk about the numbers. Even when I'm telling you that South Africa has got less than half a doctor per 1,000, it's a number. What really happens on the ground is that lives are being lost. So that for us is non-negotiable. So we think government can plan better, and we really hope that this year is really the last year where we have a group of doctors that have been trained by taxpayers' money in the main, and are unemployed.
What are the chances?
The good thing.
What are the chances, Dr. Nodigida, that these people ultimately find work internationally?
No, they're very high. The South African training and just on its own, the medical training, both under and postgraduate, is globally acclaimed. It's one of the most respected medical trainings across the globe. So the demand is there. I mean, even ourselves at SAMA, we got quite a number of international agencies knocking into our door. We had a couple of them from Ireland, which we pushed back because for us, these doctors belong to the people of South Africa, and South Africans need them in the system. So we pushed back, hence we tried to engage the Minister of Health and the Minister of Finance, because we know that South Africans need these doctors more than maybe Canada, Ireland, which are the countries that have approached us. So there's no, they will, indefinitely, if they are not appointed, they will leave. We can't stop them, but we would really love South Africans to work in South Africa and serve the people. And in the main, even in the survey we conducted, the doctors show interest of specializing in South Africa, serving their community. There's and the specialties that they want to specialize in, are actually a mirror image of a study that was conducted by Percept, which shows what type of specialties the country will need by 2030. So these doctors are actually interested in those type of specialties.
Is it a case also that perhaps we don't have enough public hospitals per se, which would be able to absorb these doctors as well? Because one wonders whether private practice changes things in any way and what the ratio split perhaps is there.
We have more than enough hospitals. Well, in fact, we do need more in other areas. But remember, this is a function of the response we're getting from National Arabel is that there are posts in the state. The posts are there, but they are vacant and unfunded. So they don't have the funds. We sat down with the minister, we did the maths on our side, and the minister did the maths, and we arrived at the same number, that we needed, at the bare minimum, 1.9 billion to absorb all of these doctors. So we are aligned with the numbers with the minister, and the minister has the posts available. They are there. The problem that the minister was raising in our meeting was the issue of funding. Hence, we then agreed that we also need to engage Treasury so that the planning from a health point of view needs to improve, because you knew that you were going to get 1.8 with your scholarships in Cuba and in other places. We were very clear that by this time we'll have this. So it can't be that it's now almost a surprise. So We really think at SAMA that the issue of healthcare, when doctors have been trained and when the system needs them, we cannot negotiate that. I see that even with the reviews of the policies in health, one of them is the community service of doctors. You remember, community services is a statutory requirement. So it means government must plan, must put budget aside for all of the doctors who are currently doing their second year internship to be placed in rural hospitals where they in underserved areas.
Yeah.
So part of what government wants to review is to see. The minister said that he doesn't think that there's a need for that policy anymore.
Sure, Doc. Let me close off. Let me close off here, Doctor, if I may. We've just run out of time, but let me close off here. What does this then do for things like research funding as well? Because it means that the priorities of the department at play here are clearly misaligned with what is needed and what is in the sector already.
Yeah, of course. I mean, this is why at the South African Medical Association we think the country is not really prioritizing the one of the most important sectors, which is the health sector. I mean, Arabil, research, the research in healthcare and even introduction of technology in healthcare, if we could invest the way we should as a nation, we would be able to even predict before diseases happen. We could do we could practice what is called predictive medicine. That's research, but you need AI and its application in healthcare to be able to do that. You could do precision medicine. So we could predict what you are going to suffer from 5 years, 10 years from now. We could have what we call in the South African Medical Association a universal electronic health record for all South Africans, meaning wherever you are in the country, you can access healthcare at a click of a button and your history would come through, regardless of which sector you are at. So those are kind of investments that we're looking at, and that requires high level of planning.
Yeah.
It requires
Doc,
high level.
Doc, appreciated. I think it's the understanding and knowing what it is that is needed in the sector. And clearly, the health minister knows, and clearly a lot more work then will need to be done in this regard. Appreciate your time this morning. Thank you so much. The CEO at the South African Medical Association, Dr. Mzulungile Nodigida.